Okay, so the first thing we're going to talk about is movement analysis and essentially why it's important. So the first obvious question to ask is why do a movement screen? And the main reason we're doing movement screens is to find a baseline of movement patterns. Now, we want to make sure we do this without giving the client too many cues or instructions on how to perform a particular movement. Essentially, because, like we said, we're trying to find a baseline of how this client moves and what's comfortable for them. This will also give us some ideas on maybe some imbalances that they may have, either asymmetrically or symmetrically. And that could be anything in that list you see to the left. So, another thing we wanted to talk about was faulty movement patterns. And of course, we all know that it's important to identify them, but we just wanted to list some reasons to why we believe it's important to identify these faulty movement patterns. So, some of the reasons we identified was it's obviously if there is a movement pattern that is faulty, it would thought to be that it is inefficient and that the patient is not doing it in the most efficient or ideal manner. So, for example, if a patient's performing a deadlift and the bar is 3 or 4 feet out in front of them, and then they try to pick up the bar from that position and perform the deadlift, we obviously know that it would be more effective for the musculature to lift the bar closer to the body, making it more efficient. The other reason is something called the physical stress theory. Now, you all probably know what this theory is without actually knowing the name, and this is just the idea that to get a certain adaptation, whether that's strength or putting on more muscle mass or things of that nature that most people go to the gym for, you need to apply a certain amount of stress to said tissues, whether it's ligaments, muscles, tendons, things of that nature. Now, increasing that tolerance will, of course, provide adaptations, and that requires some level of stress. Where it becomes a problem is where you overload the tissue, and that with faulty form, you can do this, overloading the tissue and causing injury at some point. So these are the two reasons we wanted to talk about why it's important to identify faulty movement patterns. Now, I know I just got done talking about why it is important to identify bad form or faulty movement patterns. But what you have to know is a statement that might be slightly controversial and is perfect form does not exist. I know, I know, kind of shocking. Well, here is why ideal form does not exist. And that is because every client is an individual and has different anatomy. And so, what we are looking for is for someone to find or a client to find their ideal form and what is most comfortable for them. Yes, we have some general guidelines on how someone should do a squat in the most effective manner, or how someone should do a deadlift, or an overhead squat, or an overhead press, all those movements. We have general guidelines, but what you need to really stress is that this patient finds their ideal form that is comfortable for their movement pattern. So, another reason that form isn't the end all be all when it comes to someone's overall health and fitness is that it's only one piece of the puzzle. You can see in this diagram over here, something called the biopsychosocial model. And it's just to summarize, it's essentially just stating that there are several different factors that go into someone's well-being. So yes, good and decent form is a part of that, but you've got to remember that there is several different factors that go on throughout someone's life that will play into their well-being. So just a preview of the rest of the course material, what we will cover and what we won't cover. So, what we will cover is motivational coaching strategies and how to effectively give back feedback, how to perform an effective movement screen, which we've kind of touched on in this PowerPoint, and then fundamental principles of form for common barbell movements, such as the deadlift, squat, row, and bench press. What we won't cover is we will not do a detailed discussion on the scope of our practice, and we are not going to be doing programming specifics and general guidelines.
So this was a topic that was requested when we sent out our pre-intervention survey. So this was something specifically requested by you guys. We want to cover coaching and feedback. So first, let's start off with a discussion of the phases of learning. So there are three phases: cognitive, associative, and autonomous. The first is cognitive, and this is when first the client learns what to do, and then they begin to learn how to do it. Really, they're just getting a feel for an exercise, and it requires a lot of conscious effort. That's why it's called the cognitive phase, because they're thinking about each component of the movement. Next, we move into the associative phase, and this is when errors start becoming less common. They've got an idea of the exercise, and they're beginning to fine-tune the movement. The client understands how the movement should feel, and they're beginning to self-correct. Finally, the client moves into the autonomous phase, and this is, just a walk in the park for them. They don't really have to pay attention to the components of the movement, and all is well. Next, we'll talk about some feedback. So there are three components of feedback. The first is the source, the second is the focus, and the third is the schedule. So we're going to spend some time talking about each of these components. So the feedback source can be intrinsic or extrinsic. Intrinsic is inherent in the movement itself. It occurs naturally during or after an exercise is performed. It's continuous, and it can come from any of the senses. Extrinsic feedback, well, that's you as the personal trainer and the tools at your disposal, like music, a metronome, a mirror. It can be auditory, visual, or tactile. The next component is the feedback focus. So we can either focus on the performance of the movement, or we can focus on the results of the movement. So for the performance of the movement, this feedback is going to occur during or immediately following an exercise. And again, as the name suggests, we're focusing on the quality of the performance. For knowledge of results, we're focusing on the outcome or the result of the performance. So an example might be, you just did 10 squats, whereas for knowledge of performance, while they're doing the squats, you might say, yep, your knees are looking good, yep, hips are tracking good, that kind of thing. And knowledge of results usually are given immediately following an exercise after you get the results. The final component is feedback schedules. So feedback can either occur in real time as the client is performing their exercises, or it can be what's called terminal, which is at the end. And terminal can be either immediately after they finish, it can be delayed after they finish, or we can do a summary, which might be, after completing all 4 or 5 or however many sets of an exercise that you're performing. The feedback can also be variable or constant. So if our client is doing 10 reps, a variable feedback might be, we give them some cueing on the second rep, the third rep, and then we wait until the 7th, the 8th, and the 9th to give more feedback, versus a constant, every 2 reps, we'll give them feedback. So that's a lot of feedback. And what kind of feedback should I use? Well, most importantly, you want to ask your client. They'll often tell you how they learned and how they prefer to receive feedback. And you need to modify your feedback each client to client based on what they want. Also, giving them the option promotes a sense of self-control, and they'll have more buy-in. Ultimately, the goal with our feedback is autonomy. We want to do as little as we can in feedback. And I say that knowing that in the beginning, you're obviously going to need to give more, but we eventually want to taper, because let's face it, the majority of us are not going to be personal trainers at the University of Florida Rec Sports Center forever. So eventually there will come a point where we are no longer training our clients, and we don't want them to feel like they were coming to us, for 3, 4, 6 months, a year, however long it was, and they had really good workouts, but they really don't know what to do. We want to shift the power into their hands and slowly bring them up so that they can exercise on their own and feel confident doing that. That being said, there is a general guideline for what kind of feedback we should use, and it's based on those phases of learning we went over earlier. So in the first phase, the cognitive phase, as you would expect, it's going to require more frequent feedback, even constant, because constant feedback is shown to deliver faster skill acquisition in new learners and new exercisers. We want to be using real-time and immediate terminal feedback, and we can use both knowledge of performance and knowledge of results. Once our client kind of gets a grasp of the exercise and they're starting to fine tune it a little bit, we can move into the associative phase. And this is when we want to start avoiding excessive and extended use of feedback. We want to shift more into an intermittent pattern, and that's going to help with better learning retention as opposed to faster skill acquisition. And we want to move more to knowledge of results and less knowledge of performance. Finally, we get the autonomous stage, and the feedback is faded, so very minimal. Summary is good. You know, as I mentioned earlier, at the end of all of your sets for a certain exercise, you might give a little bit of tweak. But then we also want to ask the client how they thought it went, because at this point, they've developed what's called a frame of reference. They know what the exercise is supposed to feel like. They know how they're supposed to move. And we really just want to encourage them to self-reflect. Less feedback leads to better problem solving and, again, self-correction. And that's good because it leads to better transfer to new tasks. So, you know, if our client only trains with us for one package, and we only go over a handful of exercises with them, but we can shift their feedback into more of a self-correction mode in the autonomous phase, then even if we teach them the barbell deadlift, then they might feel completely confident going to do a trap bar deadlift because they already know kind of what the idea is for similar exercises. So next, we'll move into some motivational coaching strategies. So, you know, feedback is something very difficult to give to people without sounding critical, and it's not easy, but it is definitely important in what we do. And there are a few things that you can keep in mind to help deliver better feedback that's more constructive and not just simply a burden to our clients. So the first is focusing on the positive. And there's a few steps that we can do to do that. So first, we want to focus on what they did right. You know, hey, you just did 10 squats and your hips looked awesome during that whole thing. You got down to depth, it looked good. Next, we want to introduce what they could do better. But I noticed that your spine was starting to round a little bit. You're starting to lean forward during your squat. Next, we don't want to leave them hanging. We want to offer them a solution. I think that what you could do maybe during the next set to make this a little bit more straight is you could keep your chest up. And then, you know, by then they're thinking, okay, well, I could do that, but why would I want to? So then we want to explain to them why we're giving this feedback and what the benefit is. I want you to keep your chest upright because that's going to lead to a more neutral spine, and that's going to allow you to lift more weight and reach your goals faster. Finally, we want to invite them to share their thoughts and to assure their understanding. So not only are we using a teach back mechanism to which we can make sure that they, you know, actually heard what we were saying, but we also want them to share their input, again, shifting to that self-reflection, autonomy, and ownership over the exercise. Secondly, we want to make sure that we're empowering our clients. We can't be standoffish and hesitant in what we do. We need to portray confidence in them and to them. So really what this means is that we need to show them that we think that they can do it. Next, we want to educate our clients. We want to give them the tools they need for success and always explain the why. So again, going back to, we're not going to be with our clients forever, even as much as we love training with them. The odds are we're not going to be training with them forever, and we want them to have the power to exercise on their own and confidently. We want to make sure that we grow their confidence by offering supervised independence. So what this looks like is, instead of, you know, forcing the exercises on them and just giving them these programs, we want to encourage them to make their own choices and correct them as we go. Guided learning is going to yield to more intrinsic motivation, and this is going to help with long-term exercise adhesion. Finally, we need to remember that the client goals are greater than our goals, and we need to map their workouts based on what they like and not what we like. Okay, finally, always relate your training back to their goals. Why? You know, it's such a short little word, 3 letters, but it's so powerful. And I feel that we often, in the hustle and bustle of our training routines, can forget this and forget to bring it up with our clients. we need to always bring them back to why they are training with us. Why did they decide to get a personal trainer? Why did they decide to exercise for the first time? Or why did they decide to pursue this new goal? Why do they feel like they can't exercise on their own and that they need us? Why are they exercising at all? So it's really important to bring back these big picture ideas and to put into perspective all the little things that we're doing, because let's face it, nobody really wants to get under a barbell and squat a bunch of weight. It doesn't feel good, but we're doing it with a purpose, and we need to be reminded of that purpose, and we need to remind our clients of that purpose. And here are some of my references. Thank you. So the entire point of our presentation is to talk about identifying any movement limitations our clients might have and how to change the exercise form to accommodate and correct them. It would be very hard to talk about this without bringing up the topics of stretching and foam rolling, so we're going to take some time to talk about each one, starting with stretching. So in stretching, it's important to remember that normal range of motion is a prerequisite for, but does not guarantee normal movement. There's a lot of other factors that play into our ability to move, and we can't forget that. We need to be able to control our bodies as we move the range of motion we possess, and that requires neural control and a lot more factors outside the scope of this presentation. It's also important to note that too much of a good thing might be a bad thing, and that we need to optimize our range of motion, not maximize it. We should stretch until we have enough for what we want to do. Now we'll go over a couple of types of stretching. The first is static, the second is dynamic, and the final is ballistic. So static stretching is best for lengthening tissues and gaining long-term range of motion. We can perform this either at the end of the session after we're already warm, or we can do it at a completely different time after doing an appropriate warm-up. The key here is that we want to have warmed up already, and we don't want to stretch a cold muscle. Generally speaking, the longer time that we hold a stretch, the better the results are going to be. But many of our clients may not be able to tolerate these long stretches in the beginning. So we want to start with something a little less aggressive, maybe something like 3 sets of 20 seconds or even less. And we want to progress to 1 set of 60 seconds. Anything beyond 60 seconds doesn't really affect us, and there's diminishing returns beyond that point. The second is dynamic stretching. This is best for warming up and for short-term gains in range of motion. It promotes dynamic flexibility and readiness for movement. Dynamic flexibility can be defined as muscle activation throughout a range of motion. This includes a couple common things that we use, like mobility drills and even the movement that we're about to execute. So what I mean by that is that when we're preparing for a lift, we want to start practicing with body weight and then move to an empty bar and then move to workup sets before moving into our working sets. Finally, we have ballistic stretching, and this is essentially high velocity bouncing dynamic stretching. There's no added benefits in increasing range of motion for this over dynamic stretching, and in fact, it may actually limit range of motion because it'll trigger something called the stretch reflex, and this will encourage active contraction of the muscle. Because of this, we can also injure connective tissue or muscle, so it's best to avoid this kind of stretching. All right, next we're going to talk about foam rolling. So we'll start with what it does. It does create a physiological response to increase short-term range of motion through tissue plasticity. It does create a chemical and neural change leading to a temporary decrease in local pain, and it does increase blood flow to the tissue. However, it does have some limitations. What it doesn't do is it does not create enough force to deform thick fascial tissue. It does not lengthen tissue. So it takes a significant amount of force to make any kind of change in our connective tissue. And it just isn't enough for us to foam roll and say that we're making any of these changes. The release that you feel when you're foam rolling is actually stimulating mechanoreceptors, which are embedded in the fascia. And that's essentially sending a signal into the muscle and causing it to perform a quick local spasm. It's changing the tonicity of the muscle, and that's the release that we're feeling. Unfortunately, it is also no more effective than a dynamic movement warm-up in movement preparation or for other active recovery techniques after the workout. So, should I use it? Well, my answer is yes, go for it. If your client likes it and believes that it's helping them, then why wouldn't you? However, it is important that we educate our clients on the mechanisms behind it, and we want to avoid a psychological dependency on the foam roller. Again, it's important to remember that it's not a magic bullet, and all of these benefits that it has are still a little bit controversial, and they may be minimal at best. Here's some of my references, and thank you.